Hello, Dr. Zakir, Senior ENT Consultant. So the topic is chronic salivary. Salivary means infection of the salivary glands. The saliva is produced by salivary glands. So in one person, we have three sets of salivary glands: parotid gland, submandibular gland, and sublingual gland. So I'll give a small introduction about the salivary glands, then I can go into the main topic. So this topic is divided into part 1 and part 2. So this is part 1 where I am dealing with a small introduction to start with, and why you have this complaint, the patient gets this complaint, and the patient complains and doctor's examination findings. The second part I'll be dealing with mainly with the investigations and the treatment. So let me tell you about the structure of the salivary glands. So there are three pairs of salivary glands. The parotid gland, this is the parotid gland which is just below the ears, surrounding the lower part. Then you have the submandibular gland which is just below the mandible, and the sublingual gland which is just below the tongue. So all the same three sets you have on the other side: parotid gland one pair, submandibular one pair, and sublingual. Altogether it produces 1 to 1.5 liters of saliva per day, and even the secretion for them is different. So this much of basics will be enough, I think. Now going into the causes why the person gets chronic salivaritis. See, I'll tell you a few predisposing factors. The main being repeated infection of the salivary gland can result in chronic salivaritis. Acute means the episode or the complaint of the patient is just for a few days. Chronic means the patient has got infection for a long time, and that specifically that is more than 3 months. And he gets a repeated episodes of infection, say about 2 to 3 times per year. That is chronic salivaritis. Now the few reasons for that is: one is repeated infection, or the second one being there may be small stone formation in the gland or in the duct, outflow duct. So this is called as calculus in medical terms. So this results in blockage or the outflow of the saliva, and all the saliva will pent up inside the salivary gland, and it invites infection. So we have repeated infections. And the third reason being, suppose the patient has got malignancy, for maybe let it be any site in the head and neck, and he has to undergo radiotherapy. So there also you have salivary gland changes. And autoimmune disease means everyone, we have a system inside the body which protects us from anything which enters our body. Let it be bacteria, virus, fungus, protozoa, any sort of allergy. Sometimes what happens is our own body system, instead of protecting us, it eats up or attacks our own cells. This is called as autoimmune disease. In this condition, if it so happens it attacks our own body system, especially the salivary gland, then you have changes in the salivary gland. It can go into chronic salivaritis. It can result in chronic. And infection, when I say, let me say for one more thing, it can be chronic specific or chronic non-specific also. So that's what happens in infection. The complaint of the patient will be, the complaint of the patient will be, he says that he gets a recurrent attack of pain and swelling over the concerned gland. If it is the parotid gland, it will be below the ears. If it is submandibular gland, it will be just below the mandible. Especially so whenever he eats. So this one episode, it keeps on repeating. That will be the main complaint of the patient. Now, when he presents to us, the findings, it depends upon, he comes to us when he has acute pain or when he doesn't have any complaints at all. Means that particular time he doesn't have complaint. So first let us deal with the situation number 1, where he has got an acute episode where he has got a pain and swelling over the concerned gland. Why he has got pain and swelling over the concerned gland? Because he has come as an acute episode. So that time, that particular gland, whether let it be parotid or submandibular, that will be enlarged, and when we touch it will be painful, and when we massage the gland, we can see pus pouring out from the duct which opens up into the mouth. Suppose the second scenario where he comes to us when there is no pain, but he gives us a history typical of submandibular or parotid gland salivaritis. He says the history like that. Now, when we examine at this stage, when we massage the gland and we examine the orifice which opens into the mouth, we see the salivary secretion, it is very scanty, very less, not the usual one. So, this is how chronic salivaritis presents. So, this is part 1. So, please do watch part 2 where I will deal with the concerned investigations and the treatment. Thank you so much.